these newer studies, more modern studies, actually show that it does go up.
Is there anyone who ever comes to you who might have had some of these traumatic experiences, traumatic injuries, and because of their lifestyle, they've been able to negate the inflammation? Or is there always going to have to be some kind of need some testosterone? You've mentioned some other other hormones. Is there going to have to be some hormone replacement therapy at some point?
It's a great question, Jimmy. What we found is called biological resiliency. What that means is the body's ability to fix itself. And we hook into that network, that system. And so in terms of what they can do, we know things like fish oil, omega-3s. Dr. Michael Lewis, Colonel Michael Lewis, retired, wrote a book called When Brains Collide, talking about fish oil and how they can drop inflammation in the brain. So fish oil is in every one of our products, the Brain Rescue, Brain Care 2, Brain Rescue 1, Brain Rescue 3. They've got fish oil in it, but a unique component of fish oil called DHA. There's EPA and DHA. DHA is very unique in the fact that it turns on a lot of protective chemistry of the brain and drops inflammation in the brain. Quercetin, very good, 500 milligrams twice a day. What it does is it drops a triggering mechanism, what we call a transcriptional signal that goes into our DNA and turns on inflammatory chemistry. That's what quercetin does. It's called NF-kappa B. It helps to downregulate that. Tocopherols, the vitamin E's. There's alpha, delta, and gamma. Gamma tocopherol is extremely good for dropping inflammation. N-acetylcysteine, another one that the federal government did some major studies on. So to answer your question, yes, there's a lot of things that we can do. Eliminating inflammatory nutrition, so low inflammatory nutrition. Staying away from alcohol. Very important. Alcohol is a nemesis for us. And then there are certain medications that will change the chemistry in the brain. Things that affect GABA production, things that suppress luteinizing hormone that generates our steroidogenesis, like narcotics will do that. It also influences thyroid hormone, also influences growth hormone. So there are things that we can do. You can also take in good protein, red meat, and get growth hormone turned on because certain amino acids, lysine, arginine, alpha-ketoglutarate, these are things that can turn on the production of growth hormone. So yes, and in a study that came out, just to backtrack a little bit, a study that came out in 2013 talking about inflammation shutting off the production of testosterone. And it's a fascinating area. And what they found is that there are cells in our brain called astrocytes that produce a chemical called PGE2 that helps the area of the brain called hypothalamus release the signal to tell the pituitary to release luteinizing hormone, so that can go to the thecal glands of females to generate hormones, or to the Leydig cells of a male to generate hormones, testosterone, and so forth. So they found inflammation shuts that mechanism off. And that's the majority of the vets that we see in our private civilian population who have had trauma. They've got inflammation that has shut down their testosterone production. So what do? We shut off the inflammation. And our products are 100% nutraceuticals. They all come from, natural stuff on the box, or they can go to the tbihelpnow.org under the science, and they can pick up it's the Brain Rescue 3 data sheet. It has all the products and their composition and what each one of the components does. As I said, I'm an educator. I want people to know exactly what they're buying, what the benefits are, and there are tens of thousands of articles on each one of the components to support what they do, how they do it. So yes, biological resiliency, you can build that up. Exercising will increase brain-derived neurotrophic factor, which is a key element to help with regeneration of brain tissue. There's also peptides out there that you can inject that will increase the production of brain-derived neurotrophic factor. I'm working with a popular, back in the 90s, he was famous at that time, boxer, middleweight boxer, who got into a bad fight and he lost his title, but he had a stroke after the insult. And 29 years later, his sister, Lisa, comes to us and we assess her brother and we start him on appropriate treatment based upon the laboratory results. And we added one of the peptides that increases brain-derived neurotrophic factor in 3 months. After 29 years, in 3 months, according to everybody else, not me, he's about 20% better. His pastor, sisters, therapists, everybody, and they enumerated where he's improved from the past. And so we have technology that can absolutely help with recuperating brain function. And you can do it through activities. Cold plunges increase it also. High impact aerobics, high impact interval training, these all produce greater levels of brain-derived neurotrophic factor. Staying away from fats and sugars helps increase growth hormone testosterone production. In a study, a more recent study, looking at high impact interval training, they found that testosterone goes up. In the past studies, testosterone didn't really go up. It was because you dehydrated from the activity that made it look like testosterone has gone up. These newer studies, more modern studies, actually show that it does go up, that it does increase. So yes, there's a lot of things you can do without pharmacology, without hormone replacement. But when you have someone who is living on the edge, thinking about ending their life, what we want to do is we want to accelerate fixing them, and then we'll modify their treatment so that it'll be more self-reliant on good lifestyle. Yeah, some of the people need to be on certain of the thyroid deficiencies. We've converted a couple of the inflammatory thyroid conditions using selenium to drop the inflammation so they make better thyroid hormone, T3 being the specific one. So yeah, biological resiliency. That's why I don't use growth hormone straight off and why I don't use testosterone straight off. Because the worst thing that I see happening in these male clinics, these mills that are out there, is the fact that they don't assess them and try to understand why their testosterone is low. It's just a knee jerk. Your testosterone low, take 200 milligrams of testosterone instead of, oh, in your history, you've had head trauma, car accident, this, that, and the other. Let's do a blood test that looks at, LH, FSH, and testosterone and see what the pattern is. And if the pattern is this, let's try to fix it by anti-inflammatory specific, nutraceutical anti-inflammatory, and stimulating your system to click back on. And that's why we use so much of clomiphene citrate and eclomiphene, because this is the way that we've been able to turn the systems back on. If we can turn on a client's system so they don't need injectable testosterone, look at the benefit. They can continue through life without having to stick a needle into their leg, buttocks, arm, or abdomen. They take a pill. We just finished with a 56-year-old Army major out of Fort Hood who 6 months in his program, he's off of 8 medications that were hurting him, not helping him. And at the end of 6 months, he stops our program except for one of the brain rescue products. And he's continuing to make his own testosterone, 56 years of age. He had been in the military, I think 23 years, long time, and exposed to a lot of action or traumas. So that's what we do first. We try to return their system back to normal functioning. And we'll know in 3 to 6 months whether or not we've succeeded. You have people who are impatient and want it yesterday, you know. So we have to deal with both mindsets.